Hello, everybody, and welcome to this month's IMV Imaging Journal Club. My name's Sam. I'm one of the vets that works here at IMV, and this month's Journal Club is my choice. So, if you haven't joined us for Journal Club before, welcome. Just how it all works is that every month, a member of the IMV team will choose a journal article or a critically appraised topic, and we'll create a presentation based on it and put that out available to sort of view on demand as well. So, you're welcome to just listen along, but if you do want to get involved, you can pop any questions in the Q&A box, or you can reach us on clinical@imv-imaging.com as well too. So we'd love to hear from you, and please, if you've got any questions or queries, do send them along. So as I mentioned, this month's Journal Club is my choice. So I've chosen this paper from JAVMA, just on the ultrasonographic diagnosis of femoral fractures in large animals as well. So it's slightly different from some of the small animal topics I've done recently. So this was an interesting paper. So just to do a bit of background to it, so femoral fractures, as you imagine, in large animals, are pretty catastrophic injuries as well. They're relatively sporadic, but they are one of the most common long bone fractures that occur. And when they do occur, there's often a number of accompanying signs such as swelling, crepitus, and rotational instability of the limb as well too. But the difficulties you can imagine with a lot of the large animal species that we treat is that the signs of a sort of femoral fracture, especially if they're more proximal within the femur, can be obscured by the large overlying muscle bulk as well too. So femoral fractures do occur more often in younger animals as well. And as you mentioned, they're catastrophic. So that generally when you're looking at horses weighing over 200 kilograms or cattle over 300 kilos, which is obviously a lot of them over a certain age, it's really euthanasia is recommended for them when they reach that size. So when these injuries occur, they're pretty bad news. So traditionally, as you would imagine, the diagnosis is relied upon radiography as well, as we would for smaller patients. However, if you've ever been in the situation for these patients with these fractures, there's a number of real issues with using radiography. One is you've got to get the patient to the equipment or the equipment to the patient, and that's especially difficult because of the large overlying kind of muscle bulk, is that it's very difficult, especially with proximal femoral and fractures, to actually get a diagnostic radiograph because a very high output generator is required, or in a lot of cases you need sort of radiographic projections that are going to be unfeasible in that sort of species as well. So if we're talking about something where we're trying to take a ventral dorsal radiograph, for example, of a large animal, it's very difficult, and all these things are combined with the risk of anesthesia and the risk of then inducing them and recovering them, where the injuries can be worsened or further injuries can be sustained. And again, we're using high radiation doses, so we've got that exposure issue at all. So radiography has a number of problems which make diagnosing femoral fractures very difficult. And the benefits of ultrasound, and the reason why we're kind of looking at it in this paper, is that ultrasound is widely available, it's portable, we can take it straight to the patient's side if they're recumbent as well. And in already, it's the sort of initial sort of imaging modality, and the sort of first line imaging modality in equine patients for sort of pelvic fractures and pelvic bony damage as well. So there's already slightly that precedent for using it as well, rather than radiography. So this study was designed to document the use of ultrasonography to provide a definitive diagnosis in femoral fractures in large animals with severe acute upper hind limb lameness. So this was performed at a university teaching hospital, and they went and reviewed the records of patients that had ultrasonographic evaluation of the femur and the pelvis over a 20-year period. And any animal that was diagnosed with a femoral fracture was considered, except horses that had third trochanter fractures, because that was something that had been a piece of sort of research, and that data had been looked at in another paper as well. Always good to look at how they're doing this, how these were performed. So when we're looking at ultrasound again, we've got these large muscle bulk covering these areas. So we need something that's going to allow a good depth of penetration of our ultrasound as well. And that's performed using a curvilinear or convex transducer, like we can see on the right here, and with the frequency of about 2.5 to 5 megahertz as well. And in these situations, they clip the hair and then they wash the skin with soap and water to remove any gross contamination, and then coupling gel was applied. So again, all of this is done to really make sure that we're getting as good ultrasound penetration into the patient as possible to see at depth. So during the study, they were evaluating the pelvis and coxofemoral joints. It's not the focus of this sort of paper today, and they didn't go into the technique because it's been described elsewhere. But it's worth pointing out that we have some really good resources on pelvic ultrasonography for horses as well. So this is available on our website. You can just see this at the top right here just now. This sort of a little copy of this sort of poster there. So if you are interested, please check out our website, and you can download that poster and have a look at the technique for pelvic ultrasonography as well. But for the femur itself, they were evaluating it from the greater trochanter to the stifle in longitudinal and transverse planes. So as we'd expect, they're using two orthogonal planes as well. And this lower image on the slide is just from the paper itself copied out, and it's just showing some of the different transducer positions and the resultant image as well. So in A, they've got a longitudinal axis sort of plane image that's just more proximal in the femur, looking at around the region of the third trochanter. So you can see in this middle image, this composite ultrasound image, you have the more proximal part on the right, image C, and then we've got the third trochanter of a horse here, which is quite a prominent bony projection from that part of the femur, which is marked with the 3T label, and then we have the more distal part of the femur here as well. So image D on this side is looking at effectively is the equivalent of this part of the C image, where we see the proximal part of the femur here, and image A, which is looking from the third trochanter distally. You can see more this image B that we see here as well. Now, this is typical for ultrasound of bony structures. The bone surface, we've got that very kind of well delineated echogenic interface as well, and then that typical sort of shadowing area below it, below the surface of the bone. And we can also see the fibers of the muscle bulk overlying it as well. So nice, quite a nice image of the bone surface to allow that detailed assessment. So when they were performing the ultrasound to examine the patients that they reviewed in this, they were looking for any bony incongruities along the femur as well. So we're looking for step defects, so notable sort of steps in the bone surface as well. So we've got a good image of that again below on the slide, just taken from the paper as well. So again, if we look at the image on the left here, you can see the third trochanter, and that again in a horse, that very sort of prominent projection on that side, and then we can see the surface of the bone running from there before a notable step that's marked with the arrow as well. So you can see that notable discrepancy in the bone surface, and then accompanying that, you've got muscle tearing and hemorrhage as well with it as well. So this is a good example of some of the changes they were looking at. So along with those step defects, they looked for multiple bone fragments, so evidence of comminuted fracture. They looked for motion of the fractured bones whilst performing the ultrasound. So this was either when the limb was manipulated or when the patient shifted their weight at all. They looked for movement of those fractures segments as well. And where they found the fracture, they tried to follow it as far as they could with ultrasound, and they made note of that hemorrhage and muscle tearing like we saw on that picture below as well. So there wasn't a huge number of patients in the study. There was 12 large animal patients included over that 20-year study period as well. So it's amounted to 6 horses, 5 cattle, and 1 adult Asian elephant as well, interestingly. So not a lot there. So as I said, it is a sporadic type of injury as well. The majority of the patients were presented quite quickly after the onset of the injury too, and all of them were non-weight bearing or toe touching on the affected limb. In the case of two of the cattle, they were recumbent as well. I believe one of those had been ambulatory when it was brought to the centre, but by the time it got there, it was recumbent too. 10 of the patients had limb swelling, as we would expect, and there is palpable crepitus in 3 patients as well. But the main point is that there's no cases of them had an overtly abnormal limb position or an obvious deviation of the body column that would have confirmed the diagnosis of a femoral fracture before using diagnostic imaging as well. So that's the important part. So using the ultrasound, they were able to diagnose comminuted diaphyseal fractures in 6 patients. So here they were seeing either multiple step defects, bone fragments as evidence of comminution of the fracture, again, movement of the fracture fragments as well. During the ultrasound process, there wasn't any evidence of crepitus as well. 2 of the patients had greater trochanteric fractures as well, so they had a gap or step defect near the trochanter, which could be followed on ultrasound. There was distal femur fractures in 2 patients as well. So again, looking at step defects of, in these cases, the lateral femoral condyle or the distal femoral physis as well. And accompanying a lot of these injuries, there was regional muscle tearing or hemorrhage that could be detected on ultrasound as too. As you'd expect with the elephant, if considering the muscle bulk and skin thickness of the elephant, that had a significantly adverse effect on image quality as well. So not wholly unexpected that of those, the patients they looked at, the elephant was going to be the most difficult one to examine. They also went on to perform radiography in many of the cases. So 8 out of the 12 had radiography as well. 5 of those 8 had stifle radiographs. 2 of the 5 also had proximal femoral radiographs that were negative or non-diagnostic. So already in a lot of these patients, the sort of attempts at radiography didn't really yield any useful diagnostic information. And that's the same again, coming back to the elephant in the study. The referring clinician had tried to take a radiograph. I think they believed it was a stifle injury initially, and it was reported to be non-diagnostic. Again, not unsurprisingly, and without the use of a kind of high output generators and just the size of the patient as well. Um, Radiography was able to detect femoral fractures in 2 of the 8 cases that underwent the procedure. And in both those cases, it was in cattle that had distal femoral fractures as well. So that's the image that we can see on the right just now, are the radiographs taken with the white arrows marking the fracture lines. So this was the physeal fracture and the lateral condylar fracture in the cattle as well too. In those cases, radiography was performed after ultrasound as a way of characterizing the fracture configuration as well. And so, yeah, so although 8 were x-rayed, 4 out of the 12 couldn't have radiography due to the size, the limited mobility, or the ultrasound findings had been adequate enough. Of all the cases, they were all euthanized. So as we mentioned, it's a catastrophic injury. We're dealing with patients that are of considerable size, so there's not really amenable to sort of surgical or conservative treatment for these types of injuries. 1 was sent for sort of slaughter, and of the 11 that were left, 10 had postmortems which confirmed femoral fractures as well. Interestingly, in the 5 cases that they detected comminuted femoral fractures, the degree of comminution, the degree of fragmentation, was greater than that visualized using ultrasound. So it was the comminution appeared worse as well too. And in all cases at a post-mortem, there was regional hemorrhage and edema as well from there, barring 1. Sorry, there's 1 case, but I didn't have that, but the others did. So just summarising the discussion from the paper, so ultrasound was the initial imaging modality used in all of the cases, and it was the sole modality used for antemortem diagnosis in 75% of them. So again, just highlighting the benefits of sort of ultrasound in these patients over sort of radiography as well. Again, coming back to mentioned at the start, none of the cases had femoral deviation that was sufficient for diagnosis before diagnostic imaging as well. And interestingly, the cases that had detectable crepitus, they sort of were pointing out that the origin of crepitus is frequently misinterpreted. So we saw that in that a lot of the injuries were actually suspected to be pelvic or stifle injuries because of the kind of presence of crepitus being misinterpreted as where its source was as well. And not dissimilarly, although a lot of as we would expect, a lot of the patients had limb swelling, the extent and the location was very variable. So again, due to sort of gravity, the effect of sort of where any kind of edema is going to sort of pool as well, and it didn't always sort of match up the sort of swelling. Sometimes it was kind of regional or more localized, but not always exactly where the fracture was as well. So this was one of the kind of points that quite highlights the use of ultrasound in these cases is that severe femoral swelling and lameness can be present with other less catastrophic injuries such as muscle tearing as well too. So this is where it can be quite useful to use ultrasound to actually differentiate between these more severe injuries and ones that potentially will be able to recover from. A few of the things that they noted that were very important to performing this technique was one was just having the ability to use the low frequency ultrasound transducer. So having that low frequency range to be able to get that penetration was really important as well. So again, it's having the right equipment too. And then something that makes complete sense is a good anatomical knowledge as well. As we saw on the earlier ultrasound images, that third trochanter, and if we're looking at this textbook image of the pelvic and femoral region, the third trochanter is this apostrophe 6 on the center of it. That bony prominence is very prominent in horses as well. So if you're not used to its presence, it would be quite easy to misdiagnose that as some kind of step defect itself as well. And then flipping that, if you're then scanning a bovine patients where the third trochanter is much smaller, it would be potentially you could miss a defect in that area if you expected the region to look like that of a horse's as well. So you might actually be a step defect there. Somebody may interpret as normal because they're expecting a larger bony prominence as well. So a couple of things that are very important is just making sure you have the anatomical knowledge and then examining the contralateral limb where possible as well too. And then as we've highlighted at the start, there's real difficulties with radiography due to, especially of the proximal limb, due to patient and equipment factors. So limitations, this is the sort of obvious one in this case was a very small number of cases. This was they accounted for less than 1% of the femoral pelvic ultrasound examinations that were performed during the study time. So it's very few. They did point out that actually a lot of earlier cases that were diagnosed with femoral fractures didn't actually have ultrasound examinations because it's just showing that sort of change in the approach to using ultrasound for these type of orthopedic injuries. So sort of with the fact that it's become more of a kind of noted first line technique for equine pelvic injuries, more cases were then going on to have it, but this was in the later period of the study. So there's a lot of cases that are kind of particularly were femoral fractures that just never underwent ultrasound as well. Um, there are kind of limitations in that ultrasound is unable to configure comminuted fractures. So this fits with that discrepancy between what was found at PM and what was seen on ultrasound as well. And as a comparison to radiography, it's difficult. There's notable limitations with radiography that we've discussed, but the use in the studies in patient was very variable, and it was of limited use in evaluation of the femur in these cases as well. So it's hard to draw too many conclusions about sort of how well radiography could help in a lot of the cases, other than it probably wasn't that helpful for most of them. So The kind of clinical relevance of the paper. Well, I thought this was a really interesting paper. It certainly made me think more about the use of ultrasonography for orthopedic injuries as well. So I remember being in situations where you're dealing with recumbent cows, you suspecting sort of limb injuries, and there's cases I can think back of with hindsight where ultrasound would have been very useful to examine those areas had I known more about that, the technique as well. So I think it's definitely something that has real relevance and real utility where we suspect these types of injuries. And that goes beyond thinking of just, in this case, the sort of femoral pelvic region. There's real sort of point there that if you've got an ultrasound machine available, and because it is very portable and especially with newer units that are really lightweight and can easily be brought to places, there's a good utility there for actually examining these bony areas to look for evidence of fractures, looking for those step defects as well too. So I think it's very useful for that initial acute phase when we've got a patient with trauma and they need to make a decision at that point about what is done with it, and especially when we're considering conditions that are almost inevitably in a lot of cases going to lead to them being euthanized as well. I think the big part of it though is having the correct equipment. So if you are going to be performing this, it's important to have that low frequency capability as well. And the big part I think as well that hits home from the paper is just the anatomic knowledge as well. When you look at the difference between the sort of the shape of the femur, the shape of that third trochanter in bovine patients to equine patients, you can see why it's important to have knowledge of those areas. So maybe thinking if you are doing this technique is if there's a space to sort of practice on a patient is actually having a look at the pelvic and the femoral region and just getting used to what normal is would be very helpful, but definitely a really relevant and useful technique. So that's it. That's my rapid run through of the paper. Hopefully, you've enjoyed it and you thought it was interesting in the same way I did. If you've got any questions, as I said at the start, we'd love to kind of hear from you. You can get in touch at clinical@imv-imaging.com, or you can pop a question in the little question mark box that we're seeing, and that should reach us as well too. So you'd like to hear from us if there's any comments or anything you want to see about our journal club or anything you'd like to see in journal clubs going forwards as well. But all I have to say is thank you for listening. And my name is Sam, and I hope you enjoyed this journal club.